Hello, everyone. Welcome to today's webinar. I'm Lisa Silverman. I am URAC's Client Education Specialist, and I am here today with my colleagues, Dr. Sean Griffin, URAC's President and CEO, and Joe Moore, one of our pharmacy accreditation reviewers. Quick housekeeping. We have been at Zoom webinars for 3.5 years now, but if you have any technical issues, message Nick Davis. We use the chat box for everything for Q&A and comments, and we're going to ask for some of your ideas and comments today. Heather Bonome, our Director of Pharmacy, is in there, and she's keeping an eye on your questions to make sure that we can do our best to answer them. Just as a quick note, we don't answer questions about individual accreditations during our webinars, but we will make sure that we get back to you within the next few days. And please, if we chat in resources, including some of our websites, please chime in and look at those resources. And this webinar is being recorded, and we will send out the recording to everyone in about a week. So here's our agenda for today. We're going to tell you a little bit about URAC. We're going to figure out who you are. We're going to tell you a little bit about URAC. We're going to talk about our passion for patient safety and how that's really woven through all of our programs and everything that we do. And then we're going to give a couple of examples of our pharmacy standards that show how patient safety matters and even how some of our accredited clients have met those standards. We're doing this in honor of World Patient Safety Day taking place this Sunday. It's a sponsorship out of the World Health Organization, and we are proud to acknowledge the day. The floor is yours.
Thank you so much, Lisa. I'm really excited to be here. It's actually a beautiful day in Washington, D.C. It's cooled down a little bit. It's nice outside. I'm thrilled to be here, even though I do see some Michigan fans in the chat, and I'm from the University of Iowa, so there's a little bit of tension there. But we'll work our way through it. So, hi, folks. I'm Dr. Sean Griffin. I'm the President and CEO at URAC. I've been here for several years. Thrilled to be part of this organization. Glad to be here to talk about patient safety and the things that we do. Those of you who know URAC from the relationship with us, we have specialty pharmacies, community pharmacies, mail service pharmacies, the whole pharmacy area. We're really the recognized leader in our work with pharmacies. We're doing a community pharmacy program where we're going to highlight things like vaccine provision and point of care testing and those sort of things in our pharmacy programs. But we also cover all these different parts of healthcare, hospitals, health plans. We're one of the largest, most influential telehealth accreditors in the United States, and we've got accreditations in telehealth across the world. We started cut our teeth as an organization utilization review, but we also do utilization management, credentials verification, health websites, all those different things. We're actually about to roll out health equity accreditation, a workplace employee wellness accreditation coming out in the next month or so. So we are all over in healthcare, a lot of work in specialty pharmacy, and love to be the leader in specialty pharmacy accreditations. Next slide, please, Lisa. So we have a passion for patient safety. When we talk about accreditation, we see accreditation as being about quality across healthcare. We really think of ourselves as an organization where if you see that an organization is URAC accredited, you can know that someone has come in and checked behind the scenes, that they have come in and they have made sure that organizations are doing things in the right way. And every single one of our programs, takes the bar that is out there for regulatory or legal compliance and raises it to a new quality threshold. So if you're going to do any program with URAC, you're going to be compliant with the regulations. You're going to be involved in quality improvement and quality oversight, where quality isn't just a hobby that you do on the day that the accreditor visits, but it's something that's sewn through what you do as an organization. We're very keen on making sure that that the people who are doing the work are qualified to do the work and trained to do the work. Because if you have the wrong people doing the wrong job, you end up with the wrong outcome, and that's not safe for anybody. We also want to make sure that as you do things, if you're in pharmacy and you're keeping track of outcomes, that you're making sure that people are getting what they need, all of those things. We're also going to make sure that if there's concerns raised to an organization, how do you deal with them? But also as an accreditor, if there's someone who's concerned about what you're doing in an accredited program, they can come to us, and URAC will actually investigate what's going on and see if there's a problem with the standards or a problem with what you're doing with your program. And we think that's part of what accreditation is. Accreditation is a higher bar than regulation, and it's a faster response to problems and to difficulties. But we don't do it because we want to catch people doing something wrong. We want to make sure you have the processes to be doing things right. And that's about the people, it's about the processes, it's about tracking the outcomes, and it's about training on the quality infrastructure that you deal with as an organization. And this is just a fast webinar we're doing on this Friday. And so I am very excited to be joined now by Joe Moore, who's going to come in, and he's one of our pharmacy reviewers, and he's a huge Penn State fan. So another Big Ten person sitting at the table, but he's going to go into more depth on these standards and give you some more detail. So Joe, welcome aboard.
Yeah, thanks so much, Sean. And welcome to everybody. I'm really excited to be a part of this webinar today. I was very happy when Lisa asked me to join and have a chance to talk with you all about patient safety and some of the things that we have in place at URAC to allow the pharmacies to be able to show their dedication and compliance with these patient safety standards. So on the screen right now, you'll see a breakdown of the different focus areas that are part of Specialty Pharmacy version 5.0. And really, throughout these, and Lisa mentioned this in her introduction, patient safety is woven in each of these standards. And I really could choose any one of these and give examples of how that commitment to patient safety is demonstrated. But we've really just chosen 3 so far for today. And what I want to be able to do for each of those 3 is be able to talk about them in a little bit of depth as far as what's required by organizations to be able to demonstrate compliance with these standards. But more importantly, I want to be able to discuss examples that I've seen in real life, how organizations have been able to demonstrate compliance with patient safety standards. And I'm also really interested to ask you maybe what you're doing as an organization and get some of that feedback in the chat box, so we can hopefully discuss that later on if we have time. So let's go to the next slide, if you don't mind, Lisa. And so this is the first standard that I want to discuss. And so I'll give you a moment to go ahead and read through that standard as it appears on the slide. But this is part of the consumer protection and empowerment focus area. And for this standard, really what it's all about is that pharmacies must have a process in place to be able to respond to certain situations that might pose an emergent threat and an immediate threat to the health or safety of a patient. One of the reasons why I think this is a really great standard to highlight is because this standard depends on the vigilance of everybody in your organization. For example, you may have clinicians, you may have pharmacists that are doing your patient assessments, and so they're having regular touch points with the patients. And because of those assessments, they are well equipped to be able to identify any potential red flags that might mean jeopardy or danger for a patient. But you also might have just staff that work in the front of your pharmacy, whether they are ones that are greeting patients and welcoming them, maybe they're ones that are on the register, ringing patients out. Maybe these are technicians that are filling medications, performing refill calls, but really any one of your staff members that are under your scope of your specialty pharmacy that have interactions with a patient need to be equipped to be able to recognize when there might be an immediate jeopardy to that patient's health or safety, and also know what to do in those situations. Probably the process that we see most commonly from pharmacies is we see a process or a protocol in place to respond to those instances where a patient might be threatening self-harm. And that's, again, the most common one that we see. But there are other ones that are maybe a little bit more insidious, but just as dangerous to the patient. And I want to give one example of an organization that I was performing a review for. And I was doing the interview, and the staff told me about a situation where they were calling a patient for their refill, and this patient was getting a number of medications from the pharmacy, and the patient was being asked about adherence. And for each one, the patient was endorsing that they had more medications on hand than they should. And the technician that was doing the phone call was noting that this patient was demonstrating non-compliance with their medications, but also saw that this was not something that was in any of the previous notes for this patient. This was a new problem. And so it struck that person as being just odd and uncommon and a bit alarming that this patient was having this particular problem. So after a couple of these questions and the patient continuing to say that they weren't taking their medications, that technician decided to warm transfer the patient to a pharmacist, make sure the pharmacist knew what was going on, and then the pharmacist performed a more in-depth interview with the patient. And what they found out was that the patient was not in a good place mentally, and the patient had decided they were going to stop all of their medications, and certainly putting themselves at risk of any number of dangers because they were no longer being compliant with their medications. And who knows, this may have proceeded into something even more disturbing or more dangerous down the line. And because of the early attention, the pharmacist was able to continue to talk to the patient about that and get the patient the help that they needed, so that patient could continue taking their medications and continue being seen by the right kind of medical professionals to have their issues addressed. And that was, I thought, a really great example. It showed the teamwork within the pharmacy, but it also showed how it's not just the clinicians that are responsible for being able to identify this, right? It's also, again, those frontline staff members that are reaching out and talking to patients. I think that some of the best practices that I've seen, and maybe one example that might work for your pharmacy is if you think about the background on the staff member's workstation, right? Sometimes it's just a plain blue background. Sometimes it has your logo on there. But I saw one pharmacy that decided to redesign that wallpaper on the workstation to include some of the important emergency phone numbers there. And so local police force, poison control center, and even a quick reminder of what to do if you're facing an emergent situation like the one that I described. And so, you can train your employees and you can train your staff members about these situations, but once they're on the phone with a patient or patient standing right in front of them and one of these situations is present, sometimes it can be hard to draw on that training and be able to do the right thing. But if you're able to have that in such a way that's really convenient for that staff member to be able to access it, sometimes that could be the difference in being able to act quickly and make the right decision. So at this point, I want to give you a chance to go ahead and type any instances that you have from your own organization or other ones that you've heard about where organizations have been able to show compliance with this standard. Put those in the chat box, and we can circle back a little bit later on to see if we can discuss some of those. Let's move on to the next slide and the next example. So this one, again, I'll give you a moment to go ahead and read through this one. This one comes from pharmacy operations, POPs. And so this is a different focus area, but again, focusing on patient safety. And I talked about the earlier one, the one that we just looked at. That one I liked because it talked about all of the different elements or all the different roles within the pharmacy and all of them kind of sharing that responsibility. One of the reasons that I like this one, and this standard is requiring a pharmacy to have a process to be able to not just identify, but then also respond to alerts or notifications that they may receive regarding the safety of a product and then communicate that to the patient or the prescriber. One of the reasons I like this is because of that involvement of those three different arms of patient care. So this is thinking about regulatory agencies, it's thinking about prescribers, it's thinking about manufacturers. And then, of course, you have the pharmacy itself as sort of the hub that's receiving all that information. And the way that it just incorporates all those different players that contribute to the care of a patient. And so even though there's two elements on here, elements A and B, really, I like to think about this and explain this to organizations as having three parts, right? So the first part is that you're going to be receiving these alerts. And so you might get listservs, emails, you might get documents in the mail coming from regulatory agencies, state boards of pharmacy, manufacturers, and you need to be able to sift through these to figure out not just what's relevant to your organization, but what's timely and what needs to be responded to. So that's step one, is having that really strong process to do that. Step two is that process then extending to how are you going to communicate and educate your staff on those alerts that are relevant and germane to your specialty pharmacy practice. And then lastly, how are you then going to notify patients and prescribers when warranted about whatever that emergency situation is regarding the safety of that medication? And I think most of the pharmacies that I've talked to have a really good process for number one, whether that's the PIC or a compliance director, but it's always somebody's job to make sure that they're aware and they're receiving all these notifications. And they also have a really good process for probably the third step in that, which is notifying patients or prescribers, whether it means giving them a phone call or sending them an email. But what sometimes I see as lacking is that middle step. Once you receive that information and you've made that determination that that information is important to your pharmacy, how do you then educate your staff on it so that all of your staff can now be participants in that process to making sure that you're making patients and prescribers aware with it? So focusing on all three of those elements of this standard are really important to be able to show compliance.
So Joe, you see me coming on, so you know I'm going to ask you a question about
Please.
this. So I got one of those letters from pharmacy a couple months ago, and I sort of didn't know what to do with it. So is there a process or is there a best practice that you've seen pharmacies do that sort of makes patients aware without kind of getting them freaked out? As we might imagine, we may even be sending this out for mental health prescriptions, things like that. So it seems like there's kind of a fine line between what patients need to know and how much is too much information. Anywhere you've seen along the line, your experience?
Yeah, that's a great point, because certainly you don't want to give information that would be alarming to a patient when that's not necessary, when it's not really that kind of emergency situation that requires action. But you do want patients to be advocates in their own healthcare. You want them to have the information that they need to be able to be empowered to make decisions for themselves. One thing that comes to mind, Lisa, is for pharmacies that have websites, to being able to leverage that website to be able to put important information on there. And so if it's information about a medication or maybe part of a specific therapy program, maybe that's a hub that patients can then go to on your pharmacy website to be able to learn about these important updates, even if it's just a directive to reach out to the pharmacy or to talk to your pharmacist about it during your next assessment. Sometimes that can be all it takes to be able to give that patient the information that they need.
Thanks, Joe.
Yeah.
I know you have one more standard to go. And again, for those of our current clients who are on the line, please chime in the chat box how you're meeting these standards, and we'll go back to them and talk about them a little bit.
Great, thanks. Yeah, let's flip to that last standard. Okay, this one, medication distribution. I'll go ahead and give you a moment to read through this one as well. This one is, this one's, okay, again, interesting as the other ones were. The other ones dealt with different audiences. This one really kind of puts the focus on the pharmacy having a really strong process in place to be able to handle any breakdowns that take place within the shipping process. Now, pharmacies, you may have the best, most vested and validated testing of your pharmacy shipment process, but things can still happen. So if you rely on a third-party carrier, that third-party carrier can make mistakes. There can be unexpected weather. Patients that said they were going to be home at a certain time to accept a delivery may have an emergency come up and they're not there. And all of that could lead to a situation where a medication is going to be either in transit or is going to be left unattended for longer than was originally expected when the medication left your pharmacy. And so for this standard, one of the ways to be able to show compliance is you have to be able to show as a pharmacy, how are you determining which excursions exist for the different products that you ship? And so it's a great method to do this is to be able to talk to the manufacturer themselves. There's also some regulatory bodies that may make information available in general about different medications. And this is really important in specialty and mail service as well, because so many of medications that are being mailed have these specific temperature requirements, whether it's controlled room temperature, refrigerated, not as frequently, but we also see frozen as well. And so for this reason, when a medication might arrive at a patient's doorstep, it's important that that medication's stability was maintained throughout the shipment. And we understand, as pharmacy reviewers, we talk a lot about the shipping standards that are within version 5.0. But this standard is important as well, because this talks about what to do if there's a breakdown in that process. Lisa, I see you back on the screen.
Yeah, Joe, I'll let you catch your breath here for a second. I remember we did the Pharmacy 5.0 workshop a couple of months ago in February, and we had people there from New Hampshire, where it was the dead of winter, 40 below, and somebody there from Texas. And they both said to each other, feel free to use us as your shipping address if you need to test either extreme hot or extreme cold. Are we seeing that kind of like partnership with pharmacies and how they're doing it?
Yeah, that's a great question. And I get that question a lot from organizations that say, well, who am I supposed to ship this to? And I think it really depends on you as an organization. So you can certainly collaborate with other pharmacies, and I think that's a great way to do it, especially pharmacies that are accredited. They understand the standards, and so they'll be able to help you out with that. We've also seen, if you're a pharmacy that has a patient, and this patient is one that you really trust, they've maybe been a part of your specialty pharmacy program for a long time, and you want to trust them to be able to be kind of your helper on that other side. So when you ship them their medication with a data logger in there, that they can then get that information back to you. That's another great thing that you can do. And honestly, I saw one pharmacy that their staff they just relied on sort of friends and family members that they had spread out around the country, because they were trying to ship to all the different regions in the United States. And so, yeah, it's a unique problem for pharmacies, but there's lots of different ways to solve it. And I think you're right. Like being able to team up with another pharmacy is a great example, a great suggestion.
Yeah. And knowing who you have in the extremes, you have somebody in Alaska, even where something may delay transportation. Do you have somebody in a more rural area where a snowstorm could cause delays? Yep. I know our trustworthy U.S. Postal Service says they will deliver in rain, snow, sleet, everything like that. But really, what happens if that medication sits for another 2 or 3 days? Because there are blizzards in New Hampshire in February.
Yeah. Absolutely. Yeah. And so I think knowing the results of your shipment validation testing, so understanding exactly how that medication behaves in certain temperatures and for certain durations, that's the first part. The other part is getting that extra information about excursion allowances. And as I say this, I feel like I manifest a pharmacy learner, because this is such a perfect project. If you have residents, if you have pharmacy students, if you have anybody like that in your pharmacy, it's a great project for them to be able to contact the manufacturers, look up different regulatory agencies to see if there's extended stability data for any of the medications that you're shipping as part of your specialty pharmacy program. And then you'll be able to use that information to inform and counsel that patient when they have a question that says, hey, this was sitting outside my house for a couple of hours, or this medication, I'm not sure, it doesn't feel as cold as it usually does. You can be confident in the information that you have, both from your further studies of the excursion information and your own testing information, to be able to advise that patient on how they can use that medication safely.
Awesome. Joe, thank you. We'd love to hear from some of you in the chat box. It's a little bit slower today. I realize it's a Friday afternoon. But Sean, you started your career in family medicine in a rural area. What kind of peace of mind, if you know that you are working with a pharmacy, or that a specialty pharmacy, or you're working with a pharmacy that works with a specialty pharmacy, as that physician who maybe is the only physician in a county, but you have this patient who needs something, what kind of reassurance does that give you? And what reassurance should that give to the stakeholders of your accredited specialty pharmacies as well?
Well, I think we take very seriously our role as sort of the leader in specialty pharmacy and in mail service pharmacy accreditation. And the fact that we, started out with sort of cold chain, making sure something that needs to stay cold doesn't heat up. I think that we were there for years, and now we talk about, something that needs to stay warm doesn't freeze, and something that's cold doesn't heat up, and all those different things. How we just recognize that things are changing and more things are going through the mail. Whenever you're prescribing a medication, you want the patient to get an effective medication. And whether, if it's a pill, you don't want it to get wet. If it's cold, you don't want it to get hot. There's no point in writing a prescription if they're not going to get the medicine that you're expecting. Just locally here in Washington, D.C., we had a person who worked here at URAC who his family member needed medication that had to be shipped. It needed to be kept cold, and it was delivered to the wrong address like 3 times in a row. And he was like home waiting for this vital medication to be delivered. Getting this stuff right can be life and death. These can be cancer drugs. They can be immunotherapies. They can be all these different things that we face. And if you're writing the prescription, you expect it to be right, whether it be a pill, whether it be a capsule, whether it be whatever it is. And I think that taking that seriously, the URAC accreditation means that we've checked these things. And, whenever we advance the standards, whether we just were talking about cold before and now we're talking about warm, those matter. And we try and make sure that if you go through your accreditation, you're doing it right. You checked in the winter to make sure stuff doesn't freeze. You checked in the summer to make sure it doesn't melt. That's what we expect our reviewers to do. And that's what the accreditation is out there for.
Sean, I like that line. I like it as something that our clients can use, of like, we've checked it in all seasons. And I'm going to encourage our clients to know that you can use, Sean, if that's okay with you, they can use that line that says, we've checked it in the winter and it doesn't freeze. We've checked it in the summer and it doesn't melt. And you can say that with confidence, because that that. And we realize many of you are accredited. I realize we're sounding a little bit more salesy here, but we want you to know that you can use that, because that's why you're doing the accreditation, is to kind of like, part of it is building your confidence with your stakeholders.
And if you've been in the business a while, there's organizations that aren't doing it right. They're just not. And we've all gotten the Amazon package that's a little crushed and those sort of things, just because that can happen. But when it's a medication for a loved one and it's coming and it's not, even worse would be it looked okay, but in transit it got too warm and it's not effective anymore. And you're wasting those treatment times that you can't afford to waste when it's a loved one. That's what we're trying to prevent. We want it to be the best possible with all of the things going on. And that's what we hope your accreditation means to you and means to the communities that you serve, because it really is about the communities that you serve, and them being able to trust that you're responsible for your part of the chain as they get healthier.
Joe and Sean, we don't have any questions. I'm just assuming it's a Friday and people are it's been a long week for a lot of us. And we know NASP is next week. So look for the URAC team at NASP. I know Heather will be there along with some others. We'll have some presentations there. Thank you all for joining us. We'll